My battery died on my clock, and anyway, it's late. I'm looking at my computer clock, and here we have 8:01. So I'll call the meeting to order of the Legislative Audit Commission Subtopic Selection Subcommittee. Welcome, everybody. Good morning. Good morning, Representative Liebling.
Good morning.
Morning. Good to see everybody here, and Senator Grant as well. So I'm going to start out. Ms. Randall, would you first just quickly go over the process, the time frame schedule?
Good morning, Madam Chair and members. For the record, my name is Judy Randall. I'm the Deputy Legislative Auditor for OLA's Program Evaluation Division. Thanks for joining us on this early, busy morning. So you should have a proposed schedule in your packet. It was attached to the invite as well, but there's not a lot of items on it, so I'll go over it quickly. Today, we're kind of starting the process, and then as you may remember, the goal for today is to narrow the list down to, we're saying 15 topics. And then what will happen is program evaluation staff will take those 15 topics and develop background papers, really just a one-pager discussing each topic in relation to the topic selection criteria that the Audit Commission follows. That's another item in your packet attached to the invite. And so we will kind of assess the topics based on those criteria. The subcommittee will then meet again. We have it tentatively as sometime in the week of May 17th. I know nothing else is happening that week, so it should be no problem. Just kidding. But hopefully we'll find a time that will work that week. The subcommittee will look at the information compiled by program evaluation staff, narrow that list from 15 to 10 is what we would shoot for. At that point, we would do a survey of all members to gauge interest in those topics. And then the subcommittee would meet one more time to go from 10 to the final 5, which is the number we're looking for this year. And then the full commission would also need to meet to approve those topics. So it's a multi-step process. We, over the past couple of years, changed the order a little bit so that you could get input from staff before we do the survey, so that we don't put a topic on the survey that maybe isn't really feasible, so that we don't mislead members as to something that we could do. So that's a high-level overview of the process, Madam Chair.
Thank you very much, Ms. Randall. I think that's really good to see us have a schedule. It's going to be a little different for members to have a time when we do this outside of the legislative session. That's very exceptional. We don't usually have that. We're usually well done by now. At any rate, that's the process that we will go through. And then, Mr. Nobles, do you want to say a few words before we get started?
Madam Chair, thank you. All I want to do is say thank you. I know you are all very busy, and so your willingness to take on this additional responsibility is much appreciated. So thank you. And I'll just turn the rest of our presentation over to Ms. Randall however you want to proceed, Madam Chair.
Okay, so we'll move on to the agenda of choosing the topics. So Ms. Randall, you want to head out into that and any preparation that you have?
Sure, Madam Chair. Thank you. And members, I think the first thing to just remind members of is what the criteria are, the topic selection criteria are that the Audit Commission has established. I think that helps us as we think through the topics that you'll select to move forward. I'll run through them really quickly. The first one is state resources. So how much state money is going into this program? That's something that usually more money is usually something that ranks higher on the rankings. The next criteria is state control. Does the state have control over this program? The most obvious thing to think about is if it's a federal program. Well, it really won't matter what we come up with or what our recommendations are, because the state wouldn't be able to have an effect on that. So when we think about state control, we think about a program that the state can control. This year in particular, and I do want to spend a little time talking about timing and resources and selecting very narrow topics. Another thing to think about related to state control is how much is the program handled at the local level. So if it's something that's really done by counties, even though there is ultimately state control, this year in particular, that might not be a great topic for us given our compressed timeline. The third criteria is impact. This can have a lot of different meanings. It could mean it affects a lot of people, even a little, or a lot of people a lot. Roads, roads affects everybody in the state, high impact. It could also mean it doesn't affect as many people, but it has a really profound impact on those people. So an example of an evaluation we did was one on guardian ad litem program. It doesn't affect as many people as roads, but gosh, it affects those people really deeply. So impact can be interpreted in different ways. Next criterion is timeliness. Is it a good time for us to do an evaluation? Is it a brand new program and there's no data? Is the program about to sunset and so we're not going to be making improvements to it anyways? Did we just do a report on this evaluation last year? And so doing another one right now might not be the best use of our resources. Those are the things to think about related to the timeliness criterion. Feasibility. Can OLA do it? Are there data available? Do we have the right expertise? There are some examples on the list where we would have to be questioning, for example, decisions made by medical doctors. That's not our expertise. So thinking about what lends itself to program evaluation and the set of skills we have. And then finally, balance. This can take a lot of different things too, but in theory, the idea is to not pick all education topics or all human service topics for a couple of reasons. One, that's a lot of burden to put on a state agency, frankly. And then also we want to provide useful information to numerous committees and numerous legislators. And so rather than kind of inundating one committee with our good work, we like to kind of spread the love. So those are the criteria to think about as we select the topics. The other thing I'll just say quickly before I turn it back over to you, Madam Chair, and let you manage this is the timing. And I just want to have a pretty frank conversation with you all for just a couple minutes. So we're probably not going to be getting topics until really the end of this month, early June. So our timeline is compressed that way. I will freely acknowledge that we are still working on projects you all assigned to us last year. We have 3 still in the pipe. This year has been difficult. OLA is still, of course, committed to providing you the accurate and objective and useful evaluations that we always do. I think this year we have not done great on timeliness. And obviously there's a lot of factors to that. We had a big learning curve, as did everybody, related to COVID and remote work. Most of our work can still be done remotely, but we had to change kind of things related to site visits and file reviews where we'd have to go to an agency. So we need to think about our topics a little bit differently that way. Another challenge that we had, and I'm trying to think how we can better address it this year, but it will be an ongoing challenge, is working with agency staff. Used to be, we'd be sitting in our office, we could just pick up the phone, call them, they would answer because they were at their desk. Well, now nobody's at their desk. And so yes, this year at the beginning of our evaluations, I will say to commissioners and agency staff, we need your cell phone, we need the best way to reach you immediately, but we also reach out to stakeholders and to school districts and counties and other people where we're not going to necessarily have the best way to reach them. So what's happened this year, and I anticipate it will continue, is we call their desk phone, we leave a message. They call us back, but they might not call us back immediately. And then there's a game of phone tag. And then it's like, well, let's set up a Zoom call a week from now to answer this 5-minute question. And so, and I get it, right? I think we're all, I'm not pointing fingers. It's just the reality of the situation. And so while we will do everything we can up front to ameliorate that, I'm worried that that is going to still continue. So as we pick our topics this year, considering everything that's going on, the fact that we're still finishing up things, I would really encourage you to think about the questions that are being asked. To the extent we can find some narrowly scoped program evaluations that will still add lots of value, that's the intersection I'm looking for. And I think if we can continue to have a conversation throughout this process, I think we can get there. So that's the end of my soapbox. Thank you for indulging. Madam Chair, at this point, it's up to you how you want to handle selecting the topics. The list in front of you has 88 topics. They're organized by general subject area, as they typically are. There were a number related to COVID-19, and so we kind of boxed those at the front page of the list, just so you could see that. I mean, also thinking about balance, but these span across different subject areas, but they're somewhat related. And so the way we've done this in the past takes different forms. Sometimes members have a general discussion about topics. Sometimes they say, let's each get our top 3 or top 5 on the board, and then we'll see where there's overlap. In the end, we're trying to get to about 15 topics.
Thank you very much, Ms. Randall. I really appreciate that. This is always a challenging time because we see so many good things. We'd like to have them all and we can't. And I think your comments to us about us on our own, looking forward, especially this year, on some of those topic selection guidelines, to really strongly consider that in regards to what we do choose. There are a variety of ways that we can do this, but generally I've always liked the idea of that we go round robin the first time and let each member of the subcommittee make a choice and go through that. And I see that Representative Hansen has his hand up, so he's going to get to start first. And so my thought was, we'll go with Rick, and then I see Sandra on my top screen as well. I'll go to Tina, Representative Liebling, and then Senator Coran and Senator Klein, so that helps you to know that. Anybody have a general comment about selecting here that other than a topic itself?
Mine was actually a question, Senator.
You go right ahead then, Representative Hansen.
Thank you, Madam Chair, and Ms. Randall. When you were talking about the ability to do things, so is it, I don't want to say easier or better, if we're doing something that's more of a financial, where you can get access to money, like if we were saying, how is this program working, rather than how is this problem being dealt with? Is it easier for you during COVID to have staff where you can access data that's like financial because it's more readily available, rather than searching for perhaps objective or subjective types of questions and chasing people down, and maybe Mr. Nobles too, but that, I think that would be helpful guidance for us.
Ms. Randall?
Thank you, Madam Chair and Representative Hansen. Possibly, I know that's not super helpful, but data aren't always as clean and easy as you might think. And so sometimes getting a data set from an agency requires an enormous amount of back and forth with an agency to really understand what the data mean. And you'd be surprised how hard that is sometimes to figure out what a given field means. So, I mean, yes, if there's a data set and we can do that and analyze it remotely, then sure, right? That limits the need to kind of interact with folks and for however long we're doing this remote stuff. I think if it's more of the, as you said, it kind of qualitative work, we might take more of a sample approach or a case study approach. So rather than look at what a large number of school districts are doing, just for example, we might look at a smaller number of school districts. And so, you know, it might be harder to generalize, but we would be able to provide insight and information based on a smaller sample. So, you know, if it's strictly just financial information only, then it might be something that our financial audit group could do. And so straddling some data, some qualitative, you know, we can still do our good work. I just want to keep the questions narrow. I think that would help us.
I think, Ms. Randall, the issue is more narrowness. It impacts you more greatly than, I think, Representative Hansen, than whether it's financial or other, because they're too intertwined. It's like two sides of the same coin, and you never know which one's going to show up for you that you need. So though we do our best, but I think that's always been a challenge for us, is to narrow the topic. And it's the hardest thing for members who put topic ideas forward to keep that in mind. Representative Liebling, did you have a process question? Okay.
Yes, I did. Yeah, thank you, Senator Kiffmeyer. First of all, thank you, Ms. Randall. That was I really appreciate you laying it all out the way you did, and it's really important for us to know and understand this. And I take it you're not advocating for fewer topics, just to change the nature of them, that I gather. But I wanted more to ask Senator Kiffmeyer, so I understand the process you're laying out here, the round robin. What exactly are you asking us to do? Are you wanting us to mention one or two things we think should be on the list, or to exactly I mean, I haven't been through this process before. It's my first time on the topic selection
Mhm.
committee. And if you could just be a little more explicit about what your process is to start narrowing this, what seems like a very big list.
Right. Yes, it is. I appreciate that, Representative Liebling. And so my thought was that as we do a round robin, each person chooses one. It's just a way to get kind of the juices flowing and to see what we think. And so there are 6 of us, and we just would go ahead and get started with that. So Representative Hanson, does that answer your question, Representative Liebling?
Well, partly, I mean, I guess, so we're just gonna, by doing that, we get some in and the rest then are out?
No,
Is that,
no,
or-
no, not at all. That's only 6 and we can do 15. So it's an opportunity for us. It's the getting started is always, and also to make sure that every single member has a voice in the selection process, and by doing it the first time, going through all 6. But then I would say after that, open it up a little bit more to say whoever wants to speak for one or so. Just go from there. This has never been an absolute, we've talked about it sometimes of saying each member gets to choose 2, you know, that kind of a thing, but usually it's been more fluid than that because we have to balance topics and we try and do that. So you don't want to end up with all of them in one area. So that's a little bit of why it's somewhat fluid.
Okay, so Senator, if I'm understanding, and this is making more sense, if I hope, I don't know if this is exactly what you're thinking, but so we go around, we each name something, and then we have some discussion about it, maybe take some of those off the list if they don't meet criteria, whatever, and then we go around again and sort of do the same until we come up with the list?
Well, something like that, yes. It's
Okay.
hard to predict when you start this, what topics are going to be chosen and how that all works. But it has always been something that Ms. Randall will usually weigh in and say, that's a really broad topic. We maybe could do it, but if it were much narrower. And they don't know either which first 6 we're going to even talk about. And that way it just kind of works out. It has to be a little bit more fluid.
Perfect.
Because
Thank you.
they are not all equal.
Got it.
Yeah, all right. All right, Representative Hanson, you have, and then Sandra, and then I will go to Representative Liebling, and then Karan and Klein and Kiffmeyer. My gosh, I got the 3 Ks there. K cubed. No, K, what is that, to the 3rd power, whatever.
Cubed.
Okay, all right. Representative Hanson.
Thank you, Madam Chair. And I was adjusting based on the input from Ms. Randall, and I'm, you know, in the environment area, I guess I'm going back and forth between 26 and 27. You know, that seems like 26 is more, the MPCA petroleum remediation program would be more defined. The state parks funding is more, we have issues with state parks funding that we don't have the revenue to make things, but the MPCA petroleum remediation program would be more looking back over a very mature program as to whether it's working or should continue. So
you're choosing 26 then?
I think 26 based on what Ms. Randall had said.
Yeah. Okay, Representative Erickson.
Well, of course, my preference is number 13, the achievement gap. I think it is time that we have the department give us answers to what they have done to help school districts and charters accomplish overcoming this gap.
Okay.
There would be school districts requested of information as well, but mostly it's holding MDE accountable. Thank you. Number 13.
All right, members, just kind of keep in mind that topic selection criteria as we do this, to keep an eye on those as well. All right, Representative Liebling.
So I would start with probably number 48, which I think kind of includes 53, and I might have submitted both of those topics, I'm not sure, but Emergency Medical Services Regulatory Board. And although as I say it, I'm mindful of what Ms. Randall was saying, that I don't know if this is too big of a piece to bite off, but this is a state board that does a lot of different kinds of work, and it gets a lot of state money, and it has not been looked at before by the OLA as far as I can tell. And there have been concerns about about its governance and about how it's using its resources. And most importantly, it's kind of confusing what it does and how it works. And so it's one of these things where just sometimes, these program evaluations can be very helpful just in the description of what does it do and how is it working. And that's something I think would be extremely valuable. So I think that's got to be my number one. And I think it actually could be combined with 53. So 48/53.
Well, we'll put down 48 and then we can take a look at that. Senator Curran.
Thank you, Madam Chair. I'm tossing my number 1 and 2 between Trunk Highway Fund 65 and Minnesota Housing Finance 72. And I think I would have to pick, and right now, I would have to pick Housing Finance 72.
Housing Finance 72. Okay. All right, Senator Klein.
Thank you, Madam Chair. And I'm going to pick number 2, but after hearing the comments of Ms. Randall, I have a suggestion for a amendation, which would make it much more narrow and to the point. We've had a lot of discussion in the medical community over the last few weeks and publications around less lethal weapon use. And one of the problems is transparency around those. When are they used? What injuries result? What's the appropriate use of those? And so I think narrowing number 2 to describe specifically use of less lethal munitions by those 2 law enforcement agencies.
All right, that is number 2. And I will choose number 7. It's been a while since we've had anything in the commerce area. And so number 7 goes into their insurance rates, underwriting factors, investigation, what extent are parties provided due process in an investigation. I just think in general, focusing on the Commerce Department would be helpful. Sorry, no, that's number 7. Okay, Ms. Randall, are these particular ones fitting within the topic selection? I'm not going to ask you to answer right now because we'll get into discussion and we'll never finish to do that. And so I'll open it up though for other suggestions, or we can continue selecting in this way. And members, one of the things that I really use also is where we have a large number of legislators making the request. That's always been something that we've considered as well.
Madam Chair, why don't we do another round?
All right, sounds
Actually, Madam Chair, before we do that, I'd like to ask, could we ask other members questions about their topic selection?
We can, but again, if we continue that, we end up, and I'd like to just get our list and then.
Okay.
All right, Representative Hansen. Well, let's start with Representative Erickson this time, and then we'll follow the list.
Thank you, Madam Chair. Number 44. Number 44 is death counts from COVID-19. I had several members who were concerned about that, and I think the questions are pretty specific. Thank you.
Okay, thank you. Representative Liebling.
All right, I would go with 82, which is problem gambling. And so the state has a program, North Star Gambling. I think we contract with a nonprofit to do this, and the funding seems to be all over the place. I don't think we've done an evaluation of it, and it's one of these things that kind of lives in the shadows, but it's very important. And so I think it would be a really great topic to, again, just find out, how are we doing this? How much money are we spending on it? How is it being governed? Because I understand it's kind of got a weird governance and decision structure for how the money flows. Anyway, the fact that I know so little about it kind of should indicate that it really does need a topic, a selection.
Okay, Senator Coran.
Madam Chair, my second choice is number 65, Trunk Highway Fund utilization.
Okay, 65, Trunk Highway Fund, okay. All right, Senator Klein.
Yes, Madam Chair. I will choose school nursing, and I'm looking to see where that is in the numbers. 15.
Number 15?
Yes, ma'am.
Okay, all right, okay, it's on page 3, number 15. Okay. And I will choose number 71. Again, I've often been in DHS or other things, but I thought this time I'd try and take some of those things like that. And then Representative Hansen.
Representative Hansen, you're muted.
I'm saying I'm torn.
Madam Chair, can you tell me again what your choice was? I missed it.
71.
Thank you.
16, charter school student transportation.
All right. So I'll just repeat your choices. Representative Hansen, 26 and 16, Erickson, 13 and 44, Liebling, 48 and 82, Karan, 72, 65, Klein, 2 and 15, Kiffmeyer, 7 and 71. Okay, let's go back again and let's start with Representative Liebling. I'd like to go about at least 4 round robins.
In the interest of time, Madam Chair, you might want to skip me. I'm kind of not ready with another one here. I'll keep looking.
Sure, Senator Karan.
Thank you, Madam Chair. My third one would be 63, discharges from Minnesota Security Hospitals.
What was that number again?
63.
63, okay. 63 is 63 discharges from Minnesota Security Hospital in St. Peter. Is that correct? Okay.
Yes, Madam Chair.
All right, Senator Klein.
Thank you, Madam Chair. And I will choose, I just lost it on the list here. It's the X-rays one. Oh yeah, 47, state regulation oversight of X-rays.
47, okay. We're definitely going into some unique areas here. Interesting. Okay, and then I will choose 39. And this is election software. And to what extent do the Secretary of State and counties comply with state law requiring no internet connection in precinct polling places? I think that's narrow enough. All right, Representative Hansen or Representative Liebling, whichever is ready.
Madam Chair, my question was, is this a point where we can start picking ones that other people have picked? Do you want to see where there's multiple, or are you just asking us to pick ones that we're interested in?
I think right now ones you're interested in yet.
And then I have another clarifying question on number 74, the prevailing wages for housing projects. I think Senator Krant had picked housing, the state housing agency. So could this be part of that?
We'd have to ask Ms. Randall. Are they close enough for doubling up for a combo, or are they unique?
Madam Chair and Representative Hansen, I hate to say no to anybody, but I think they're both big, distinct projects, frankly.
So I'll pick 74 then.
Okay, 74. And Representative Liebling and Erickson. Representative Erickson, did we get your third choice? No, not
Madam
yet.
Chair, 58.
And that is briefly, what is that?
58 is DHS programs for direct care and treatment.
Okay. Representative Liebling then.
Okay, I'm a little bit torn between 51 and 52, both of which actually I
Okay, you guys,
suggested.
now come on, don't be taking 2 bites here.
No, they're definitely very different things. I'm just kind of torn between them. And I'm just trying to think about Ms. Randall's criteria. I think I'd really like 52, but I'm not completely sure how easy or difficult it would be. And if that
Would
one
you like
is,
to ask that question?
well, I would, and let me
um,
just give a bit of background on that. It's about the 340B Pharmaceutical Program, which is a federal program. But what I'm interested in, and what's kind of coming up and has impact on us legislatively, is that there is a flow of money between our Medicaid program and entities that use the 340B program. So it's a little complicated, but they get drugs cheaply from the feds. And then our MCOs, our managed care organizations, pay them a higher price for the drugs. And then there's a difference that they capture for their budgets. What I consider a hidden subsidy, which I never knew about before this year. And they are very cagey about explaining how much they're getting and how they're using the money. And so it's the state impact I'm interested in. It's a very, very complicated program on the federal side. And I don't even know how doable it is for you to even do it. And so if that's
Okay,
kind of way out of the scope, then I would go for 51. So that's
That's your fallback. Okay, I understand. Ms. Randall, can you comment on 52?
Madam Chair and members, I can. It looks like Mr. Nobles might want to speak to that. He unmuted. Okay. I will just say, before I turn it to him, 51 seems a little bit more meeting the criteria of a program evaluation. I am a little worried about getting the information we would need on 52. And I'm wondering if Mr. Nobles is going to mention our financial audit side for 52. That's what I'm hoping he's going to say. But if I could turn to him.
Oh, Mr. Nobles with that, okay.
I just want to mention also, just more broadly to Senator or Representative Liebling, that some of the questions that you have that are very good about, scope, doability, we will address in this next phase. We are going to take whatever topics you give us, and we're going to go back and sort out a lot of these questions and come back with a lot more answers than we can give you today. And in that process, we will consider whether or not this is something that could be done by our financial audit division or a special review. This process of topic selection is really an input for us about concerns that you have. Some of them can be addressed through evaluations, but we have other tools and mechanisms. So we can probably come back and really address your questions and your concerns about this particular program better after we have a chance to take a look at it.
great. Thank you. Thank you for that.
So I'll put that down then for number 52.
Two.
Yeah. Okay. Well, remembering though, we're gonna still have to go through it. Now, I would say, let's do a round robin again, and yes, you can choose other members or add a new one to the mix. And I'll start with you, Senator Karan.
Thank you, Madam Chair. And I'm going to double up on the on Representative Erickson's. My number 4 ahead is 58 DHS programs for direct care and treatment.
Okay. Senator Klein. I didn't have a third choice for you, Senator Klein. Did I miss it?
You may have. I had
Yeah.
the X-rays,
Yeah. What was that number?
and then I had nursing. So X-rays was 47, and
40.
nursing.
I had 2 and 15, and now 47.
Yes, and I'll add my 4th, Madam Chair, which is number 10, energy grid.
All right. Fantastic. All right. Well, I'm going to, I'm busy writing things down, and then I keep looking and working through it all. I think this issue that we have here of number 72 from Senator Karan is one that I will go also with a number 72. The Housing Finance Agency is number 72.
I wonder, it would be helpful,
Mhm.
sorry, Senator Kittmeyer, but it would be helpful, like on something like that, that is a very broad topic. You're just naming an agency. Like if I said, oh, Department of Human Services, I mean, I realize that's a bigger agency, but could somebody just flesh out a bit what it means when you're naming that agency? Are you looking
Well,
for
I
a
didn't just
specific
name it.
thing, or-
Yeah, Representative, I didn't just name it. It's in the description. How does the Minnesota Housing Finance Agency spend the state and federal funds it receives? To what extent does the agency comply with government accounting standards? So it's already narrowed in the topic itself.
Okay, but that's as narrow as it gets, though. I mean, you're not looking for okay, that's fine.
Well, it's no more narrow than your 52, I guess, but
Well, no, but that's why we're having
yes,
it's not a criticism. I'm just trying to understand it so that I can weigh what we're talking about. That's all.
sure.
So yeah, happy to explain any of mine too.
Yeah, that's okay. Representative Hanson.
I would go with 53, the medical emergency ambulance services that I think Representative Liebling had done. I know this has just been coming up year after year and it never seems to get picked. So that's my vote.
Okay. And Representative Erickson.
Madam Chair, number 12, and that's unemployment insurance fraud.
Okay. And Representative Liebling, your 4th. Either choose one of the others or another one of your own.
So I guess I'd go with 51 now, which is the prescription monitoring program.
Mhm.
So most of you are probably familiar with that. It's not a huge program. It's been going for a number of years. It was kind of controversial at the beginning. You know, if every time you get a controlled substance prescription from your doctor, your very specific information goes into that database. It's used for purposes that have moved around a little bit over the years. I think there have always been concerns about privacy and security of the data, but also, you know, what is the, it's been, you know, had some potential mission creep over the years too. And I think it's one of these things that, you know, once it's in existence doesn't mean that it should go on, and certainly not without any look at, so that we all understand what it's doing. That's my rationale. And and money goes in there too.
Okay. All right. Senator Klein.
Thank you, Madam Chair. And I'm not sure how you wanted the process to go going forward, but I seem to recall in previous sessions, once we completed our legislator input into which topics we would like, we fielded a couple of suggestions from the auditor himself about things we may have missed or overlooked, which he thinks are especially timely or apt to investigate at this time.
Yeah, I think we'd appreciate that. I think even on the topics that we have here, I would rather know now if they are scopable, and mainly that means like the topic as currently written may not be sufficiently so, like Representative Liebling's one in 52. However, that it could be with a little bit of work, and that still happens, by the way, members. It always does happen. That's not unusual. But some are just so broad, extremely difficult. Mr. Nobles, do you want to comment on any of these, or Ms. Randall? Mainly if there are ones that are pretty difficult to scope.
Madam Chair, I think I would just emphasize again that a lot of the discussion about the scopability, the specifics of what we would look at the availability of data. We will have a very robust discussion about that in our next meeting. So I'm personally not prepared really at this point to say that anything is not doable. So I'll defer now to Ms. Randall to comment.
That's helpful to know. Thank you. Ms. Randall, anything to add to that?
Thank you, Madam Chair, members. No, I think you guys actually did a really, not actually, I shouldn't be surprised, did a really nice job of selecting topics that meet the criteria and that also honor kind of the cautionary words I said at the beginning. So a lot of the ones that I had flagged as the intersection of doable and where we could add value, you've selected. So I don't have any others to add. Thank you. And I would say I do think that these are all scopable. Some might require a little more scoping, but we can get into that, as Mr. Noble said, in the next round.
Okay. Well, my one thought is to just help us move forward is that our goal is to have 15. What's kind of awkward about that is we have 6 members, and so 6 doesn't go into 15 in any real easy way. But I do think each of us could have 2 choices off of anything at all on the list, and then we'd need to mutually agree on 3. So I'd like to go around and start and say, okay, whatever 2 you choose, they will be on that grouping of the 15 final. And you can choose from your own or choose from another member's, but the point is to choose 2. Does that sound like a good approach for now? Okay. All right, well, we'll start maybe with Senator Karan. How about you start on this one?
Thank you, Madam Chair. I will have to go with my my first 2 choices, which would be number 72, and I'm sorry, hold on. Yeah, 72 and 65.
Yep, that's what I had down for you. Okay, I'm going to skip over to the House side and Representative Liebling. Which 2?
Well, since we're doing this this format, it seems, I guess, kind of obvious that I pick the first 2 I mentioned. Probably
Okay.
most of us will do that. So, I think what I had, was 48, and I think it was 82.
That's right. Okay, let's see now. Representative Erickson.
13 and 58.
15?
No, 13
13, yeah.
and 58.
All right. All right, Senator Klein.
Madam Chair, and thank you for this process. I will go with number 2 and number 10.
Okay, 2 and 10. Representative Hansen.
I will go with 15 and 26.
All right. And
I'm
I
sorry,
will-
Madam Chair, I'm sorry. Can I just confirm that you said 15 school nursing services and not 16 charter school?
Yeah,
transfer?
15.
Okay, 15, thank you.
All right, 15 and 26.
26. Yeah.
Yep. And then I have, I'm quite, I didn't write my numbers down well enough here. 39. And 39. And then I'll go with 7. Okay, so that gives us 12 out of this particular list. And then we need to concur over 3. So anybody want to volunteer one of the last 3?
Senator Kiffmeyer, could you repeat Representative Liebling's choices?
Representative Lieblings were 48 and 82.
Thank you.
So I would like to say now, you can choose either from your already named choices, or you can choose something else as well.
So many choices.
Madam Chair.
I'm sorry, Representative Hansen?
So many choices.
Yes, I know, it's just like freeze.
I think that I would vote the medical emergency ambulance services, number 53. As I mentioned, that's been on the list before. I think it's a timely topic and would be helpful to look at.
Okay, anybody else?
Well, I would concur with that. And I think it, I don't know if as I said before, if the EMSRB, the Emergency Medical Services Board, will make the cut, but there is definitely an interaction between these two things. And so I do think that's really, it is a super important issue. I mean, as everybody knows, the availability of ambulance service in parts of the state is really problematic. And the extent, I don't know what the exact questions would be, but the degree to which governance or unclear financing or anything is impacting that, it would be very important for us to get our arms around it.
Thank you much. 53 times 2. All right. Senator Coran, I'm just going to call on people. So
Madam Chair, I would, in looking through my list and the other support, I would move for 44.
Can you give us a brief description?
That's the COVID death counts. Representative Erickson also had it on hers.
Oh.
I think it's an important one. I had it on me as one of our a priority.
Madam Chair.
Fran.
Madam Chair, it's
Ms.
Ms. Randall.
Randall.
Thank you. On that one, I do want to caution members about the questions. I'm not sure they would all be answerable by us. And so before you advance it, I wanted to make sure you understood that we would not be able to question a cause of death put on the record by the medical examiner or by a doctor. We could look at the causes of death that are listed there and then see which ones were officially listed. And so we could look at the records, but we would not be able to then go further than that and question the medical decision. So I just want to be clear about what we could and couldn't do on this topic as you consider it.
I understand that. I don't know that they were implying that you'd have to go so far as to asking. I don't see that in the description, but I can see that we'd want to be sure that that would be clear, that that would not be the case. Senator Klein.
Thank you, Madam Chair. And so I think just pursuant to the process that you've set up, we each sort of got 2 individual choices. And then these last 3, as I understand, should be consensus choices by the group. And I just wanted to speak on 44 that I would oppose that one. And I can speak at length about why I would oppose it, but it's probably known. And so that would at least not be a unanimous consensus choice.
Well, Senator Klein, can you give us what is your choice instead?
Well, I apologize, I'm not immediately prepared for that, Madam Chair, but let me work hastily and I'll get you something.
Mm-hmm. All right, Representative Erickson, I don't know if I heard somebody who wanted to put something on this list for the final 3.
Well, Madam Chair, I was actually thanking Senator Curran for 44, but you know, I can understand how complicated that could be on the privacy side. So I wouldn't think consensus. I think there could be a different method used to get that information eventually. But for now, I would agree that 44 is probably not a one topic that we should consider. Otherwise, I don't have anything to add.
Okay, well, Representative Erickson, you had, let's see, 13 and 58 and 44, and you also had 12. So I'm not necessarily unemployment.
No, I did not have 12.
All right. Oh, okay. All right.
Oh, excuse me, I did.
Yeah.
But no, that's a good one. I will stick with that one.
Okay.
Unemployment insurance fraud. Yes, thank you.
All right. All right. And so
Is there
Representative
consensus on that?
Hanson, Representative Liebling, Curran, we're waiting for Klein. And Representative Erickson, 12. So that's 4 of us. So Senator Klein, you and I are left. And I will go with 12 also with Representative Erickson.
Madam Chair, I'll double up on Representative Hanson with number 15.
That was 53, I think. I have his as 53. That's
15,
emergency medical services.
yeah, 15's already in.
15's already in. Okay, I'm sorry. I'll double up on 53.
Okay. And Senator Klein, Senator Curran. Okay, I got Senator Klein. Okay. And myself. So we have 3 topics right now, 53, 44, and 12. 53.
Madam Chair.
3. Senator Curran.
Sorry, Madam Chair. So with the previous conversation, I would remove 44, and that we still need to find 3 topics we can agree on. So,
Curran, Senator Curran, why don't you make a suggestion then?
sure, Madam Chair, and I wasn't prepared. But my other suggestion then would be, let's see, we're heading at.
Well, 63.
Actually, 63 would be one. Very.
Other choices, yes.
Correct. Yep, it was a priority, and the reason I would pick that one is I'm sure all you guys have stories in your districts about the outcomes of those patients that have been moved out of there into private group homes, and the outcomes have been somewhat challenging to the point where brutal rapes have occurred, and so the oversight in that particular process really needs some type of view or review, and I think publicly understood what those decisions have done and do on a daily basis.
could I just clarify, Senator Cran, are you referring to the state hospital, security hospital, or the state sex offender treatment program?
This one is the security hospital in St.
Okay,
Peter.
okay.
Yeah.
Just your comment just now about the impact in communities. I just wanted to clarify.
All right, I see Representative Hansen and Representative Liebling. Representative Liebling, go ahead.
Yeah, thank you, Senator Kiffmeyer. I've gotten a little confused in the process here, but the extra ones we've got so far that are kind of on the table are 53, 63, and what else did we have?
12.
And 12. Okay, because I just was, you were asking, if people had another suggestion, and I, not to upset the apple cart, I just wanted to bring one forward, which would be 55, which I know that NAMI was really interested in, the Health Professional Services Program. And I did not list it as one of mine. Frankly, I have not been hearing complaints about it, but NAMI is apparently concerned. So I just wanted to put that out there if we were looking for a consensus item. If not, I'm not, trying to push that instead of any that people have picked, but I just thought if we were looking for another suggestion that might be a consensus item, that would be a possibility.
All right, thank you, Representative Hansen. And then I think I have an idea of where I think we might go here.
Madam Chair, I have to run a conference committee in 2 minutes. I was just going to note, it seems like we're light on education and higher education. So I would just throw out maybe the University of Minnesota Endowment Fund might be something very specific and tiny to look at, but I am going to have to go because I'm going to have to log on. So I have faith that you will do the right thing, and but I just wanted to throw that out there about education.
Okay. Well, Representative Hansen, while you're still on, I think that there are two of our members here who gave up one of their choices out of deference. And so my thought is, since that 63 was put on, that we ought to go with 53, 12, and 63 and take those three, and that will expedite, I think.
Yes.
Yeah.
I think that's good.
All right. So members, with that, I'll read off again what I have down, and so that we can all confirm it. 72, 65, 48, 82, 13, 58, 2 and 10, 15 and 26, 39 and 7, 53, 12, and 63. All right, members, if that's the case, I'll entertain a motion to adopt those as our slate of 15.
Madam Chair, could you quickly read that again? I'm sorry, there's a lot of numbers and a lot of notes in here.
All right, are you ready?
Yes.
72, 65, 48, 82, 13, 58, 2, 10, 15, 26, 39, 7, 53, 12, and 63.
Yep, thank you.
All right, I'll entertain a motion to adopt those as our slate of 15. Senator Klein.
So moved.
All right, that has been moved. Any further discussion? Seeing none, we'll proceed to a vote. All those in favor say aye.
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 Opposed? Motion prevails and is adopted. All right, members, that is really our business for today. And to let you know now, the staff of the Office of the Legislative Auditor go through and put a deeper background sheet on each of those 15. We will meet again in regards to narrowing it down to 10, then we go to a vote. And sometime the week of May 17th, we don't know yet. We end session on the 16th, is it?
On the 17th, Madam Chair.
Okay, I was thinking it was, all right, sometime that week after that. I think that's a Monday, if I recall right. So
17th,
hopefully
yes.
sometime that week. So take a look at your schedules and We'll do our best. We understand that sessions in the last few years have had a special a couple days after sometimes. We don't know for sure what can happen, but just stay tuned and watch for that. And we'll send you as much notice as we can. So with that, our business being concluded, we are adjourned. Thank you.
Thank you.
Thank you.
Thank you.